you so much for joining our League of Women Voters Healthcare Committee meeting. I'm excited to introduce Alexa Brenner from Planned Parenthood to give us an update. So do you have recommendations on, since I work at the health district and I've heard some of my colleagues and leaders talk about, reproductive health, how abortion is a healthcare issue. Do you have materials that you recommend, either, whether it's on Planned Parenthood's website or any of your partner organizations that can speak to that? I think when talking about topics where they can have I guess bipartisan support when it comes away from the politicians, if that makes sense. But
yeah,
any way to frame it, because I really appreciate that abortion access is not it should not be a political issue. It is a healthcare access issue, and I think seeing materials that describe that succinctly, and especially that look at the implications of the inequities, I think would really resonate. I know what when we were talking about it within the health district, we talked about how certain communities tend to access abortion more just because they don't have access to reproductive health or to sex ed and whatnot. Do you have any materials that you can recommend to those of us who want to talk about the issue of abortion and why it's a healthcare issue, or some people might see it as a social justice issue or an equity issue, that and using those terms that might resonate more across party lines?
yeah. So I definitely have like lots of different angles for stuff like that. Like the Guttmacher Institute has a lot of like the raw data, and they have a lot of interactive maps as well. So you can even like click through what happens if this state goes dark or that state goes dark, or there's a total abortion ban. Like, what does that look like? You can kind of peek through the maps and look at what numbers. They also have a lot of studies and data to go through about where people receive the most abortion care and cost of abortion care. All lots of different ways to kind of look at the statistic side of things. So if you are speaking to somebody, or you are somebody who likes statistics and data and that sort of thing, Guttmacher is a great spot to check out. Sister Song is a reproductive justice organization, and they are a really wonderful organization that has a lot of justice conversations. And they have a lot more of the social justice and equity lenses when they're talking about abortion and just reproductive justice in general, because not abortion isn't the only thing that falls under the reproductive justice framework. And Planned Parenthood is not a reproductive justice organization. We're a reproductive health org, we're a reproductive rights org, but just the nature of our work is different, even though we do our best to work in that reproductive justice framework. We aren't going to co-opt the term reproductive justice. So getting the information directly from the source, Sister Song, is a good spot to get some of that. And then there was a question about registering patients to vote. So with COVID, it's been kind of difficult, right? So we're technically two organizations under the Planned Parenthood umbrella, because you've got the 501c3 that doesn't really engage in lobbying, and then the 501c4 that can. And so we had this like middle ground program, health center advocacy program, where volunteers would be going into the health centers to help register patients to vote, have them share their story, have these conversations in the like legally allowable ways to do it. Similar, like, not necessarily vote for XYZ candidate, but voting is important, like those sorts of, the difference between those conversations. Now that COVID, it's not going away, but it's becoming more of a daily life manageable thing that we're having conversations about and figuring out how to like pull together our social society that we've lived in for years before the pandemic. We're trying to figure out how to bring back our health center advocacy, because one of the big things that our health center advocacy program did was register patients to vote.
Mhm.
I mean, we often are calling that's part of the work that we're going to be doing with our like our electoral stuff, is talking to voters and making sure that their voter registration is updated. Because if you moved and you never went on, oh, I forgot to update my voter registration, and suddenly you're not getting your ballot at your address, you don't get a ballot. And I mean, we're spoiled in Washington, right? We get our ballots mailed right to us. We don't even have to fill out a form. Whereas some places, I remember I worked in Iowa for the general election in 2018, and you had to fill out a form and like mail the form to their county auditor's office for them to even mail you a ballot. It's a whole mishigas of whatever you need to do. And now it's so much easier living in Washington, but we want to make sure that we're reminding people, hey, check your voter registration every year to make sure that you are still up to date. Or with Tara Simmons' bill, allowing people who have completed their time with Department of Corrections, they have their voting rights restored. They have to re-register to vote, right? And so it's checking in with people, making sure, hey, do you or someone fall under this category? Have you re-registered to vote? So just like that sort of work that we're doing as we are easing back into direct patient facing. Every time we go to an event, we have voter registration. Every time we knock doors, we send people with voter registration, just in case somebody in the house is not registered to vote. I know you get, they ask you at the DMV, right? They ask you, oh, do you want to opt out of registering to vote? I like that it's an opt out and not an opt in, because people will more likely than not accidentally register themselves to vote, even if they didn't intend to do it when they were getting their driver's license. But just that kind of stuff, really, weaving it into every conversation that you have. And Jessica, similar to what you were talking about earlier with abortion, right? Like, yeah, sometimes I am in conversations with people and I say the word abortion so many times it doesn't sound like a real word anymore. Because just saying the word abortion changes the way that people think about the word, because so many times people will feel like it's a dirty word, or it's not something that you talk about in polite conversation, or whatever that may be. You saying it lessens the stigma, and not only you saying it lessens the stigma for the people around you, but then they're going to start saying it and lessen the stigma in their social circles, and it's a bigger effect, right? Because the reason that people feel the need to legislate a uterus is because that we as a society, and not like we as people in this room, but society as a whole that is run by rich white men, have decided that it's a taboo thing to talk about, and we can't talk about abortion because oh goodness, what will happen? But what will happen is just that it's a normal topic of conversation, and it's not a big deal. And it's not a big deal. Getting an abortion is just like getting a wisdom tooth taken out, just a completely different part of your body. And they do give you better drugs when you get your wisdom teeth taken out than they do when you have an abortion. I've had both, and so the wisdom teeth drugs made me much sleepier.
Got it. Well, Alexa, thank you so much. Does anybody have any questions for Alexa? Well, Alexa, I'm sure questions will pop up, but please do, if you're able to stay on. I'm going to move on to an update from the health district. So that some of the topics I might talk about might not be as relevant for you, but it sounds like there may be some updates from like what Lenny was talking about from the public hospital district planning work that's been going on. And then also, Pam, I might ask you also after Lenny speaks to talk a little bit about some of the discussions about Vote ER, because I'm not sure if everyone here was familiar with some of that work as well. But thank you so much, Alexa. So I'm going to switch over if that's, yeah, we've got time. And I've got a couple of updates. And I think, as I mentioned, so I work for the health district. I am their equity program manager. And I think several of you heard that, last year, the Kitsap Public Health Board declared racism a public health crisis. And that's what created, my position and the position of um, the equity program. And I'm going to go ahead and share my screen. And after this meeting, what I would love to do is share a link, to the recording, but I will also send my slides and the links that Lenny has generously put in the chat box as well. So we can have that all in one package. So I'm going to show you what I would like to talk to y'all about, and then you can let me know if there's anything else from the health district. I know I often know a little bit about everything, which makes it kind of a little dangerous maybe, but if there's something I don't know, I'm happy to follow up on. So what I wanted to do is give you all an update on COVID-19, including the bivalent or Omicron boosters. Give you an update also on monkeypox, rabies, and then the most recent public health board meeting. So that happened on Tuesday. And in particular, I think what may be of interest to you all is that there was an update on the public health board composition. And I'll talk a little bit about that because I think it's very exciting. This committee has talked about this change very thoroughly in past meetings. And then also the Kitsap Public Health District Health Officer, Dr. Gib Morrow, shared some data regarding healthcare access. So I wanted to give you all an update on that. And then share what I know in terms of, what's going on at the health district in terms of collecting more data on what access to healthcare looks like in Kitsap County. And then at the end, I will also have a plug or advert for a community needs assessment that's being done, a partnership between the health district, Kitsap Community Resources, and some other organizations as well. And I will try my best to be succinct, but I will also, if I'm taking too long on a topic, I might just skip something, and just y'all know I will have these slides and send them via email. So for COVID, our case rate, so we are seeing cases going down in Kitsap County. Now, I say that, but also know that, with people testing at home, while we encourage individuals who test positive for COVID to call a state reporting line, not everybody does that. So we're not as confident about our case numbers because of that. But that said, we do, as a health district, we do report on the numbers we do get. So, you'll see in the middle that reported COVID-19 cases case rate, you see that huge spike, and then that was, with Omicron that caused that huge spike in February. And then you saw things drop, and then you saw that bump up in June, and you see here that there's that that decrease. So we're cautiously optimistic, but also looking to see what the fall will bring as well. You'll see that close to 90% of our total Kitsap County population, and I believe when they say total, they include all ages, have been vaccinated. And the reason why they say initiate primary series is that this 79.5%, it refers to looking at all Kitsap County residents, regardless, Department of Defense, non-military, ages 0 to however our oldest residents are, who has actually gotten their first COVID shot. It doesn't talk about, it doesn't show who's completed or who's gotten boosted, but that's just who has at least started the vaccination. So, I mean, it has increased, but slowly. You also see that, this is a snapshot from the health district website. So I'll include the link when I send an email out, but the follow-up email out, but you can actually take a look at, I believe, cases by area of the county, and also I think vaccination numbers as well. And you'll see here, so our hospitalizations, I think we're also seeing a slight decrease as well. And when I say hospitalizations, from what I understand, these are individuals who show up at the hospital and just test positive for COVID. They're not necessarily hospitalized because of COVID, if that makes sense. And you'll also see on the bottom of this graphic, the number of COVID deaths. So you'll see that, we saw our highest, in late 2021. And we did have, looks like 19 deaths in the month of August, which was relatively high. And we're at 386 deaths total throughout the whole pandemic in Kitsap County, which to me is still, way too high as well. And I believe on the health district's website, we have, and I say I believe because it's just been a while. I know we used to have some data that had some more demographic kind of information on the deaths. So COVID's still an issue. We are seeing fewer cases. We also, I'm sure you all are seeing, fewer people wearing masks and whatnot, but the rapid tests are still available. And if you have any questions, but you'll see, I don't know of any actually drive-through testing sites anymore. I'm unsure if the pharmacies are still testing. I might go check it out just to see, but the actual COVID tests themselves, the ones that you can do at home, they're still available through the State Department of Health, through the federal government, and then also through pharmacies and, Walmart, Amazon, companies like that. So you may see, I've seen in the news that, so actually it was this week, Kitsap County and others throughout Washington started receiving the Omicron bivalent boosters. So these are updated boosters. They're boosters from Moderna, and the Moderna boosters are for individuals aged, oh my goodness, there's an age difference, but one of them, I'll have to double check. Either, what
18 for Moderna.
Thank you. 18 for Moderna, and then 12 plus for Pfizer. Thank you so much, Lenny. So there are different age differences, but there are 2 boosters that are now available, and they do, include Omicron. And actually, last week, the CDC directed the states to stop offering the old boosters. So right now, except those for children under 12, if that makes sense. So for individuals for whom this new booster is available, they're unable to get the old boosters that did not, include Omicron. Boosters are also encouraged, whether you got Pfizer, Moderna, or Johnson & Johnson, you can mix and match. That still works. Now, the thing is that the supplies are still limited. So you'll see in that second bullet that, while we've been receiving updated boosters, the shipment this week in Kitsap County, the health district is distributing orders to, distributing shipments to local providers. But the health district, we have a regular vaccination clinics on Wednesdays and Thursdays. The appointments for the boosters were filled very, very quickly. But we're still continuing. So next week we have our vaccination clinics. When I looked 2 days ago, there were some appointments available. So if you are interested in getting a booster, the Omicron bivalent booster, the health district is an option, but also please check in with your healthcare provider and pharmacy as well. And as time moves on, more of the boosters will be available. So that's what I've got there in terms of what's going on there. And I can include links as well to how to get that information about, at least from what the health district is doing regarding the bivalent boosters. Yeah, and then also, if you're interested in seeing, who may have the bivalent boosters, you can also go to this website, vaccinatewa.org. And that's a website I believe that the State Department of Health maintains. And then also the health district does have information about COVID-19 vaccine on our website as well. And again, I'll be sending you all this the slideshow so you can take a look at the links directly. So switching gears a bit, you all may have heard about monkeypox. So this is a disease that, originally we heard about because it was endemic in certain African countries. And it was primarily, from what I understand, disease that children got and that others got from, contact with animals and other things. But here in the U.S., this current outbreak that we've seen, even though monkeypox is not a sexually transmitted disease primarily, it can be transmitted through sexual contact. And that's what we're seeing here in the United States. And what we're seeing in the United States, that the individuals who are most affected are men who have sex with men. And what we're seeing is that there's a disproportionate number of Black and Latino or Latinx men who have sex with men who are getting monkeypox. What's been really interesting, you may have seen these articles also in the papers. I can speak just from my observation as a public health employee, this interesting dynamic about talking about risk, but also not wanting to stigmatize the, the communities who are most affected. men who have sex with men are not the only individuals who can get monkeypox. It's just that in this current outbreak, that's who we're seeing getting monkeypox. Um, Monkeypox vaccine is available. The health district did have some monkeypox vaccination clinics in August. And actually, Lex, I think we're actually going to be I think we're planning on partnering with Planned Parenthood in the near future to also offer a monkeypox vaccination clinic. Something that's been really interesting about our outreach for this is that we have to really think about meeting our focus population, so the most affected populations, in places where they feel safest. So it's been a really so really getting back to doing more grassroots kind of outreach, because I think for years public health, because of public health funding decreasing, we were focusing more on policy and population health, and we were getting away from direct services. But when it comes to things like COVID, monkeypox, that's where we have to shift and go back to our kind of old school kind of being out in the community more, having being at clinics, passing flyers, things like that. And we're still continuing to do this outreach. And then what we are seeing, though, nationally, is that the numbers are going down. And what I'm hoping, and what I've talked to our staff about, and our staff are also interested, is still continuing outreach, but also connecting it with outreach on HIV, on syringe services, and then also other healthcare services that are men who have sex with men, our LGBT plus community, but then also our communities experiencing homelessness and who also have risk factors that may make them more susceptible to monkeypox. So continuing that outreach. So we do have more information on that on our website. We have a handout also in English and Spanish. And we also have a specific listserv. So you can get text alerts or email alerts specific to monkeypox. It is unfortunate that it's called monkeypox. It is not a disease of monkeys. It is not, I believe maybe I think initially in laboratory settings, we saw monkeypox in monkeys, but it's just an unfortunate and also stigmatizing name for the disease. So that's what I've got about monkeypox. And the reason why I want to mention rabies is because last month, a bat in Kitsap County tested positive for rabies. Some of you may know that bats are the main source of rabies in Washington State. A few years ago, there was a case of rabies that was, detected in a bat, excuse me, in a cat in Jefferson County. But in Washington State, primarily bats are the reservoir. So something that I really ask you all is to just avoid contact with bats. If you find like a bat carcass and in your house and you don't know if they've had contact with you, or if you don't know if they may have bitten you or scratched you, please do call your healthcare provider, and they can talk about whether they think that post-exposure prophylaxis would be appropriate for you. It is a very serious disease, but it can be the death and sickness can be prevented if you have treatment in time. So please, when in doubt, just contact your healthcare provider, and we've got some information about that. And I'm sorry, y'all, I'm going through these pretty quickly. I promise I'll take a breath at the end, and if you have any questions about any of these topics, to please let me know. So this is really what I'm excited about. So, as I mentioned, the Public Health Board met. Actually, before I'm going to go back because I want to introduce this slide before I kind of go into it. But yeah, the Kitsap Public Health Board met last Tuesday. And if any of you are not familiar with what the Kitsap Public Health Board does, the Kitsap Public Health District is a special purpose district. So we are not a county department. And I say that because we have our own governing body, and that's what the Public Health Board is. Currently, well, as of up to last month, the Public Health Board only consisted of elected officials, primarily city and county officials, all 3 county commissioners and representatives from all the cities. But due to a state law that passed last year, we had to add more members. We had to add at least one representative from a tribe, and we had to add 3 different positions. One being a person from healthcare or public health professional, one being a consumer of public health services, and that's very vague, but this could be someone, for example, who has received WIC services. So that's the Women, Infant, and Children Nutrition Services, or any kind of direct service, kind of like how with, I think with some clinics and Peninsula Community Health Services, they require to have patients be on their board. It's kind of similar in that vein. And the third position we had to fill was for another community stakeholder. In Kitsap County, we were very lucky. We had, I think, roughly 28 applicants. And from what I've heard from our leadership, not other, there are a lot of other counties who, when doing this, didn't have the same response rate that we had. And we had many applicants that were highly qualified. I had the privilege of looking through a lot of them. We also we worked really hard in our outreach. We had our materials translated into Spanish. I know I personally talked with organizations like NAACP, Kitsap Erase Coalition, so that's our Equity and Community Engagement Coalition, and others, and the League, to really get the word out about this. And I'm really excited because over the summer, our Public Health Board's Personnel Committee interviewed their top candidates for all three positions. And what's exciting is they had their selection, and I'm going to tell you about them in a moment. And at the Public Health Board meeting, they approved the three candidates. And the next step is for the county commissioners to vote on it, because the ultimate decision for these three non-elected positions relies on the county commissioners, and that's per state law. Now in Kitsap County, we have a position for the Suquamish tribe to have a representative, and then the Port Gamble-Sklallam tribe. So we decided to have an additional positions so we could invite both tribes to have representatives. The Suquamish tribe position is filled by Mr. Stephen Kutz. He is the health director at the Suquamish tribe, and he's also a member of the Cowlitz tribe. So we're very fortunate to have him. Mr. Kutz has just got an amazing background. But what I'm excited about, in addition to Mr. Kutz, is who the three candidates are that the commissioners are going to vote on at the end of October. So Dr. Michael Watson, so I'm going to read a little bit. So he is a practicing physician within the CHI Franciscan system. Actually, I know about him. And he's also the director of the Northwest Family Residency Program. So that's, he's got an amazing background, and it's awesome to have, to be honest, it's awesome to have someone in the hospital system on our board, because we can ask the board can ask them questions about, what's going on with the hospital, right? And he can really bring that healthcare access. Dr. Morrow is a physician, our health officer, but he does not work at the hospital, and he only has access to certain data. Some of you may have heard of Mr. Drayton Jackson. He is incredible. He is an amazing Black leader. He is on, and I say that because our board has not been diverse. And while we still have work to do, it's exciting that Mr. Jackson was not only interested, but also selected. He founded a nonprofit organization, and it's a foundation that supports individuals experiencing homelessness. He is also a member of the Bremerton School District Board, and he's got many other credentials, and he's just an amazing connector, and just so excited that he was selected. And then also Dr. Tara Kirk-Sells. I believe that she has a real great academic background. She has a lot of expertise regarding outbreak response and pandemic response. So we have this really amazingly qualified panel, in addition to our elected officials. So not only, so it's just, I'm really excited. I'm excited to see the commissioners vote on this, but I'm just really grateful that the Kitsap County, that we have this. You all have probably seen articles in the paper online, how in other areas across the country, there's so much toxicity when it comes to public health boards. Even though we have different people, even right now, we have different commissioners with very different perspectives, representing different political parties. There's been an amazing level of civility that I've noticed among our board, and I think we're very fortunate. So this is something really exciting to see, and hopefully next month we'll get to to see these new board members and see how that dynamic works with that. And then what I want to show you also at the Public Health Board meeting, and I'm going to, Dr. Gib Morrow, our health officer, did share some data on healthcare access. I am not an expert on this, so you're welcome to ask me questions, but I will have to get back to y'all on on that. But I will share some slides that Dr. Mora shared. So this is an at a glance. So this shows you how, in Kitsap County, we're doing better than the rest of Washington State and the rest of the US when it comes to healthcare insurance. So you'll see that our adults without health insurance is 5%. And our health officer really gave kudos to the Affordable Care Act in particular for this. But when you look at our population to primary care physician ratio, it's bad. I mean, it's worse than the whole US and worse than Washington State. So you'll see that we have one primary care physician to every 1,470 residents in Kitsap County. Does that make sense? So we have a total of 184 primary care physicians in Kitsap County. That is not enough for Kitsap County. And then you'll also see when it comes to dentistry, I mean, our rate is similar to Washington State, and it's better than the U.S. in general. But this is still, not good enough. That we see that for every 1,260 residents in Kitsap County, we have one dentist. So we have a total of 217 dentists. With mental health care providers, I'm actually kind of surprised about this, but according to this, we have quite a few mental health care providers. Now that I do not know what our epidemiologists define as a healthcare provider, mental health provider. And I'm sure that different providers have different like abilities in terms of, being able to prescribe medication, different areas of expertise and whatnot. So at least according to this, and I'll have to double check what this means, but 250 to 1. But when you look at hospital beds, so we didn't have that officially, but you'll see on the bottom, it says back of the envelope. So this is based on health district staff numbers, and this is why it's not in that table. But the employees at, and I believe it's the epidemiologist and Dr. Morrow, when they were looking at the numbers, their best estimate for the number of hospital beds per 1,000 is one hospital bed per 1,000 residents in Kitsap County. That is not enough. And especially when you think of pandemics, when you think of other healthcare crises, this is not enough. So this is definitely something that is of huge concern to the health district. And I know to us and, as a league and to others as well. When you look at this, so PCP is primary care provider, excuse me, and that includes family medicine, internal medicine, and pediatrics. So this shows you how it looks throughout the, oh, I'm sorry, Lenny, go ahead.
I was just going to ask, but go ahead with this. I wanted to ask if there's anything about emergency room capacity that he had statistics on, or if we can get it. If we can get it. Thanks.
Yeah, I think he may have mentioned it. I'll have to double check, Lenny. I can go through the slides real quick and see, but if not, we can definitely look. What's interesting, so I'll give a quick side note. If y'all get the chance to look at the Public Health Board meeting recording, it's fascinating. But Bremerton Mayor Wheeler, so he's also the Public Health Board chair. He made a comment about how I think he's convening a work group to look at, the feasibility of having a standalone ER in Kitsap County. Some communities have that. We don't have that in Kitsap County, but it's mind-boggling that we only have one. And I know that he had asked the other Public Health Board members if they wanted to partner with him because, of course, Mayor Wheeler's jurisdiction is just City of Bremerton. I know Posmo Mayor Becky Erickson expressed interest in this project. I don't have the total details on that, but Lenny, I can definitely double check. I mean, I'll scan through the slides, but if we don't, I can definitely see who I can ask at the health district. So this slide just shows how this looks across the state. And it looks at how, Kitsap, we have, now according to this, and I believe this is from let me see here, Office of Financial Management. So here it looks like we have 63 primary care physicians, providers, per 100,000. And you'll see that it looks like Chelan Douglas is doing better. Walla Walla, Columbia. I mean, you see here that, Chelan has 169, where in Kitsap we have 63. So, but you also see, Grays Harbor, 44, Pacific County, 30, 38. So we've got some huge differences. Oh, look at that. Wallow, anyway, no, Wallow was 126. So we just have some big differences here in Washington State in terms of access to primary care providers. This is another estimated percent of adults reporting. Oh, so this was looking at some data from the behavioral risk factors and symptoms, I think, system. I believe the CDC system, and it just shows based on people reporting, like self-reporting, having access to primary care doc. You'll see the lighter areas. I'm not sure why it's silver down. I'm not sure if that's more towards the basis, for example. So I'm not sure why that is. But you'll see like the darker numbers, which means that you have a higher percentage of people reporting have a primary care doc, Bainbridge Island, North Kitsap. But you'll see the lighter ones around Bremerton. So this doesn't surprise me when you also think about other influencing factors like income, different racial groups, for example. So we do have inequities in Kitsap County. When you look at our childhood vaccination program, so these are providers who are enrolled with the State Department of Health to receive free vaccine for children. If you look across the water in Seattle, just look at all those little dots. But then you look at Kitsap, it's really widespread. So this is also a concern for us. And what's a concern also for the health district is that, because of the pandemic, we're seeing our numbers of children being up to date on their just normal vaccinations. We're behind. And so this is something that we're also concerned about, trying to get those numbers back up. But there's so many factors involved in that. So it looks like, Lenny, Dr. Marr did not do an update on the emergency room issue, but I will see if I can ask him about that. But something I can also share is that in the health district, we're working on this huge data, so many different data initiatives. One of my colleagues, I'm hoping to have her come speak to us, if not in December, maybe in January. She's doing what we call a healthcare deep dive. And actually, if you go to the health districts, and I'll share really quickly, we have some new data dashboards, and I won't go into them because I haven't looked at them yet, which means I won't be able to answer any questions on them. But we are looking at what kind of data that we can see regarding healthcare access. This is more in terms of like what we can see. Let me see here. Healthcare. Oh, here we go. So I'm going to share the screen with you all. So at the health district, we are adding more dashboards to our indicators page. And I'm sorry if this is small on your end, but it shows, for example, all ages health insurance, adults health insurance, individuals with unmet healthcare needs due to cost. And I think you'll also see, hospitalization rates. You have like EMS rates, in terms of EMS opioid overdose surveillance. But we are adding more things. So you'll see like firearm deaths and all of that. So my hope is to get one of the epidemiologists at the health district to talk more about all of these different indicators. And then I'll give two more things. Yeah, and I'll then try to be quiet. So the health district, so I think Pam, I think you were involved in this, but some of our league members were involved when the health district did their community health assessment. And some of you may be familiar with KCHIP or Kitsap Community Health Priorities. We're revisiting that. And we're going to be looking at getting, not only pulling quantitative numbers, but also doing focus groups interviews to see what's going on in our community. Something I will want to do a plug for, and I'll include this in my meeting notes, is I hope you all have seen information about the Kitsap Community Resources Community Needs Assessment. It is, even though it says it's for KCR, Community Health, it is for everybody. The health district will benefit. Other organizations are working on this. We need to hear from everyone, including lead members. We need league members to share this information, because this survey will inform various social service organizations on what people are saying regarding access to healthcare, mental health, reproductive healthcare services as well, childhood education, childcare, mental health services. So if you haven't seen it yet, please do it. I will warn you that it isn't, even though the average is 10 survey, 10 minutes to complete the survey, I've gotten a lot of feedback from colleagues and friends of mine that, oh, it was confusing and it took too long. If you drink your cup of coffee or tea, whatever kind of gets you through really boring things, there's a lot of questions. But, they were trying to help get data for so many different organizations. It will be worth it because we will get that out. And they've even KCR has translated it into Spanish, Kurdish, and Tagalog, and they're doing focus groups as well. The data should be available early next year, January, February. So it might be kind of an interesting thing for us to look at as a committee as well. But there's a lot going on there. I will make sure to include an email about it. That survey ends September 30th. So anyway, that's what's going on from the health district perspective. And with that, I would like to pass this over to Lenny, unless anyone had a quick question. And I'm sorry, I kind of went on for a long time.
Great. Great information. Thank you, Jessica. Well, I'm really excited to see these new stats about access to healthcare, because I've had a feeling for a really long time, like there were huge gaps, and it's good to know that we can kind of pinpoint some of those better now. What I wanted to give everybody an update about, and actually, Pam, this is probably new information to you too, the public health hospital district. It's very unfortunate that PhD works for both of those. We need to keep that straight. But the public hospital district project that was approved a year and change ago at the council, the State League of Women Voters Council, has been busily working for a year. And one of the things that we did was we sent out a survey to all the leagues and to find out about where leagues were and public hospital districts were. And it was really interesting. And then we also asked questions like, do you think there are unmet healthcare needs in your district, in your league area, which mostly is counties, but not completely within counties. Sometimes it's by city. In any event, we learned a lot about what people wanted to know more about. And so the project committee has decided to do 3 webinars. We're asking the state for an education fund grant to make these professional video webinars that we can promote and share with the public, with leagues around the state, etc. The first one, we have done quite a bit of drafting of the content. There's still some holes, but we have a kind of a first version of what that first webinar would look like. And one of the unfortunate things that's happening is there's a lot of confusion at the state board level. Catherine will not be at all surprised to hear this. We're being asked to act like a study, and we deliberately did not want to do a study for a new state position on hospital districts or anything. We have asked for a public education project, and these 3 webinars, and doing them professionally is not cheap. It's about $2,000 a piece. We think we're going to do 3, but that is still a little in flux depending on where they end up. But unfortunately, we thought that that was going to be cleared and that we would have the final put together of the first one, and that we would have it ready by the end of December. That is not going to happen because the state board is not considering our request at its meeting in September. They need more information, which, if you've ever worked with a bureaucracy, the state board is no different than a lot of other bureaucracies. Catherine has said this a number of times. They're very top down. And lately, they've become very micromanagement oriented. One of the members of our project team, our public hospital district project team, is Cynthia Stewart. And Cynthia's a past board, she was board president, I think, for the state at one point in time. She was definitely on the state board. So we have a lot of experience on this committee. And you know, we know what we were doing. We were being very thorough, and there's really good material out there, and there's a lot of really good information on public hospital districts. And we're really excited to share what public hospital districts do with all the league members in the state and anybody else in their communities that they can draw in to hear about this, because public hospital districts do a lot of different things. And they're not all hospitals. There are some that run a hospice facility or palliative care facility. There are some that run emergency rooms, standalone emergency rooms. Oh my goodness. So here in Kitsap County, we are very clear, I think, and I'm just so excited that the health district is doing this deep dive on access to care. We're pretty sure we know what we need. And among other things, we're going to get more information all the time. So the status of this public health district project, education project, is we are moving forward. I'm pretty excited about some of the decisions we've made recently about what's going to be in the webinar. The State Public Hospital District Association, it's got some other name that I'm not retrieving right now, has done an outstanding video that I think some of you have watched. I sent the link to Jessica about it. It's about, I want to say 8 or 10 minutes. And what we're getting permission to do is to take that video and take clips from it and put them in at different points in time in the webinar that we do, so that we'll have all this information about, well, it's evergreen. This is, you know, the kind of stuff we do to determine what the community needs. And, you know, out in Forks, where they have, I think, 2 hospital districts in Jefferson County, and one is in Forks. So this is what is provided for us out here in Forks, and why a community-based public hospital district responds to the community's healthcare needs, period. That's exactly what they do. So we're excited about this. I'm sorry that we're not going to be ready as soon as I hope to do a trial run, but I'd like to put it on the radar for this committee that we might be one of the test groups in January, because we think we're going to be ready to go then to do what we're calling the package and promote phase. And we want to run it by, we want to run our webinar by several different groups. And I believe Pullman, which has a hospital district, is one of the leagues that's gonna either have their whole league or their healthcare committee. I'm not sure if they have a healthcare committee. I'll rephrase that. I know Pullman is interested, and I believe Thurston County will be the third group. So I'm put Kitsap forward as because we do have a strong healthcare committee as a good candidate, and we're one of the areas that does not have a public hospital district. So this is an educational thing about how public hospital districts work, what kinds of things people can, what kinds of things public hospital districts can do, and so forth. So that'll be, I think, I'm really excited about it. I'm just kind of sorry that there's this delay, because I was hoping we were going to be showing it in draft form in November, but it's not that much of a delay. And if worse comes to worse, I think there are several leagues, including ours, that could pony up ed fund money for this project if the state board gets too frustrating to work with. Right now, they're pretty frustrating to work with. So any questions for me or Jessica or anybody else? I've seen lots of great comments coming across the chat. So.
Lenny, thank you so much for that update. And you did send me the link to that public, I was going to say public hospital district video. It's an amazing video, and I'll include that link. And Susan, thank you so much for that correction. I got confused about Mr. Jackson. You're right. He is with the Central Kitsap School District Board. Any questions for Lenny? Oh, hi, Pam.
I was just going to say, I'm not sure it's clear that public hospital districts are, what's the word I want to say, secular. And that is
Yes.
one of the issues in Kitsap County, is there are services that are not provided because we don't have secular providers.
Yeah, that's one of the things we've been looking into. And it's one of the things that, quite frankly, scares the bejeebers out of some on the state board. That's all I'm going to say. They think we're, out there with this biased whatever. And, as individuals, when we chat on the committee, we often kind of, let our anger show. I shared that lovely thing from the Bremerton Fire Department about all 4 of their ambulances sitting and waiting at St. Michael's on August 12th. And so they couldn't, and one of them was there for hours.
6 hours.
Yeah, that is just so totally inappropriate for that situation to exist.
It's because the hospital wouldn't allow it. Their administration would not allow.
The hospital wouldn't allow a diversion
That was
at that point in time. And so, I mean, I think you probably have read the stuff in the Kitsap Sun about the fire and rescue response people have said they're creating their own policy, and they want to empower their teams to make decisions about diversion. And that's controversial. And, there are reasons why physicians in the community might object to saying, wait a minute, that's 40 minutes away. But the decision should not be, the decision to go to a different hospital should not be granted to administrators at a hospital. It should be granted to the people in the emergency room. They shouldn't have to get permission from higher up, in the organization, and that's the way it's done right now. And I find that there's a process issue here, and so I applaud the fire and rescue people for getting out there and saying we're not gonna, And I'm here to tell you, if I'm in an ambulance and they go to St. Michael's and they say we can't take you right now, I'm going to ask them, and you can do this as an individual. You can say, take me to Tacoma General now. I don't care what's wrong with me. I'm not going to wait 40 minutes and then I'll get seen in the ER at St. Michael's. I could be somewhere else in 40 minutes. So anyway, that's my very personal opinion. I do not speak for the league here, but I'm very concerned about healthcare access in our county, and I think everybody on this call is too. Anne has a question.
Anne,
you're muted, Anne.
Make a comment. There's a difference between waiting in the ambulance outside of St. Michael's or waiting in the ER for 5 hours, 2 days, 3 days because they don't have a room. And I can tell you, I was one of the people that had to wait 5 hours for a room. And then I know 2 elders, one is Artist Morrow, who waited 3 days after she broke her leg and dislocated her shoulder, 3 days in the ER before she got into a room. That's absolutely abominable. You know, she should have been diverted to another hospital or something.
Yeah, both,
Ridiculous.
both situations are bad, but the hospitals, the ambulance situation is
No, I
really
understand.
tragic because it means they can't respond to the next call.
Right.
So
no,
when I
understand.
see these guys at North Kitsap heading out and going down to Paulsville, I know exactly what's going on because they're covering for way up here in Hansville. They're sending their ambulance down to cover for somewhere in Paulsbo or Silverdale.
So
And
it's,
Bremerton has the same issues. So
there's
it's-
definitely a lot of problems with that system.
yeah.
A lot.
Yeah. So anyway, the focus of the public hospital district project has been to see what is possible with a public hospital district. And I should make very clear that a public hospital district, as Pam said, it's secular because it is a special purpose district, just like your library or the public health district or whoever. So the challenge to setting up a public hospital district is all the same as setting up any other special purpose district. But the income to public hospitals and the other facilities that they run that aren't hospitals comes the same way any healthcare income comes. A little teeny piece of it. I think some places it's as much as maybe 10% of the income for the operation comes from taxes. 90% of it comes from all the normal places, insurance, Medicaid, Medicare, et cetera. So it's not like a public hospital has, some kind of different financing structure. It has a little teeny bit of a piece. And the nice thing about that is that the public hospital district commissioners are elected officials. And we have one on the committee now who is from Pullman. And she's a league member and has been a public hospital district commissioner for 17 years. And she has a lot of information to help us share. So we're really excited about the work the committee is doing. That's the last thing I want you to know. And we're going to look at trying to share with you the video, the webinar, which will have lots of other educational information like we do for anything. The league does a great job, I think, at educating voters. Did you know that? Local election stuff. So anyway, it's exciting, but it's frustrating too.
Thank you so much for that update, Lenny. Pam, would you mind giving an update on what happened over the summer regarding Vote ER?
Yes, we had these lanyards made that come with actually our name on it as well as Vote ER. Vote ER came from an ER physician in Boston who thought that a lot of people, particularly low-income people who come from their healthcare, do not vote. And his approach was, we've got to get that, energize that population to vote and to press on the elected officials the need for improved healthcare. He doesn't say how, so it doesn't go one way or another way. It's just that healthcare in the United States needs to be better. And what way better to do it is to get those who are receiving or not receiving healthcare to be vocal with their elected officials. And so we had, Julie and I met with a young social worker. That was her project, to bring Vote ER to Kitsap County as a project to get people in the medical field to encourage their patients to get registered and to vote. And with Jessica's help too, we did approach Peninsula Community Health Services, just thinking that their clinics all across the county would be a really good place to do this. Well, I've been in contact with, his name is Todd Johnson, and he works for PCHS. And I gave him our lanyards because his didn't come in. And he just told me this morning that they are going to set up a registration booth at the largest clinic, I assume it's the one in Bremerton, to register patients, encourage them to vote. I don't think it was well enough organized to go to more than one clinic, but I was really pleased that he will set that up at the he said the largest clinic, and I'm assuming that's the Bremerton one. So they will have a table out there on National Voter Registration Day, the 20th of September. So at least that's going, and so I was pleased to see that.
Awesome. Thank you so much for that update, Pam. So we've got about 15 minutes left. Wanted to also update you all. Let me see here. I got an email from Kim Abbey, who I think she's the outgoing
Right.
healthcare systems chair for the state league. There are a couple things. So any of you are interested, there is a League of Women Voter Washington Health Affinity Group. Sorry, I'm reading the email right now so I can let you all know. There are going to be 3 upcoming healthcare affinity group meetings. There's going to be one at the end of this month that will introduce the new issue chairs. So the new healthcare leads for the state, and Jody and Mary Lynn. And then there's going to be another healthcare affinity group meeting after November 8th. So understanding the election results and effects on healthcare legislation. So it'd be great to actually, after that meeting, then kind of bring the lessons learned to this meeting in November. And then there's going to be another meeting in mid-January to discuss the healthcare bills and announce the Health and Senate healthcare committee chairs and members. So I will include that information in the wrap-up email from this meeting. So in case any of you are interested in being involved in the healthcare affinity group, while I get the emails, I'm just too overwhelmed with life that I don't get to go to those. But if any of you are interested, I definitely would encourage you all to do that. I know Kim has done a great job sending information out about what's going on, from the state perspective. What I also wanted to share was that I approached Shannon Turner with PCHS, so Peninsula Community Health Services, to speak at our next meeting. And so I just need to follow up with him. He did express interest in talking with us. He is I think his title is the Medical Operations Program Manager. And if I'm correct, I'm going to tell you what I think he does, and he can actually provide more details. I believe PCHS is working on a facility in downtown Bremerton where individuals who get discharged from the hospital, who I think might meet some sort of criteria, can get taken care of there, so they don't get necessarily released to the streets without getting the proper care. So I'm going to circle back. He and I are both in the NAACP, and so we're all kind of focused on the banquet tomorrow. But I will circle back with him to see if he's available to talk with us at our October meeting. And then what maybe I'm hoping for, and I would love your input for our November meeting, is if anyone of us can go to that November healthcare affinity group that Kim is talking about, then we can have like a kind of a feedback from that. Something I also wanted to just throw out there, especially letting hear your comments, is there is a group in Kitsap County, and Susan, I think you may have also been invited to this group too. I think their name is the Alliance for Equitable Healthcare. And this is a coalition of interested individuals that Carolyn Zimmerman, and I'm having Matt Macklin, and oh my gosh, I'm having a lot. Anyway, I forget the name of the third person. There were 3 individuals who pulled this coalition together. I think at least 2 out of 3 of them are affiliated with the Safe Secular Healthcare Group, in addition to the various Kitsap, I think North Kitsap Indivisible. I might check in with them to see, what they've been up to. And that might be something also of interest, because I know that they were hoping to look at addressing healthcare access and whatnot too. So I think it may be interesting to hear what organizing is currently happening regarding that. So I can circle back either with Carolyn or, I'm so embarrassed, Sue Brooks Young. I think her last name is Brooks Young. I can't remember her first name. But to see if any of them would be interested in meeting with us at some point as well. Lenny and Catherine, you've got your hand up.
Yeah, I just want to know when 2 of the commissioners will be getting off of the healthcare committee. Is that correct? And when will that happen?
It's a really great question. I'll have to double check. So you're absolutely right. You're talking about the Public Health Board. Yes, there's only going to be one. So right now, all 3 county commissioners are on the board. I think the board has to, I think the commissioners actually have to decide who's going to be their one rep. And I don't know when that transition will start. That was not mentioned at the last Public Health Board meeting. So I can ask Catherine, I can definitely get back to you on that.
Okay.
Unofficially, it wouldn't surprise me if Commissioner Gelder was the one that's recommended, just because he also has a healthcare administration nonprofit background. But yeah, I can definitely ask, because I'm not sure when that transition will happen. Well, it's 2:00. Thank you so much for your time. Thank you, Alexa, so much for staying on as well. We'll have a recording and there'll be a follow-up email in the next couple of weeks, but have a great rest of your day, and I'll maybe see some of you all in October. Thank you so much.